Good day, I'm Pearl Angela Sabal from BSN 1B, and today I will be demonstrating to you the donning of the sterile gown and sterile gloves close method. So the purpose of this procedure is first to enable us to work close to the sterile field and to enable us to hold sterile objects freely. And lastly, to prevent clients on becoming contaminated with microorganisms on the nurse's hands, arms, and clothing. Following the nursing process, first we will begin with the assessment. We will need to check or review the client's data or records and orders to determine exactly what procedure we will be performing that require the use of sterile gloves and sterile gown. And then, we will need also to check the client's record and ask about any latex allergies so that we can use the non-latex materials or supplies whenever it is necessary or it is possible. And then we will now proceed to the planning, in which we will need to think through the procedure. We will need to plan which step need to be completed first before applying the sterile gloves and the sterile gown. Also, we need to determine what are the additional supplies we will be needing for the performance of the procedure, and make sure that you have an extra pair of sterile gloves with you that is available to use. And then, after that, assemble the equipments you will be needing to perform the procedure, which is the packs of the sterile gloves and the sterile gown. After doing that, we will now proceed to the implementation. For the preparation, first we will need to ensure the sterility of the sterile gown and the sterile gloves. We will need to check if the sterile glove package is properly sealed and packed without no holes in it. And we will also need to check for the expiration date of the sterile glove package. So the one I will be using will expire on the date or the month of July 2025, and June 2025. And then we will also ensure the sterility of the package of the sterile gown, so there are no holes in it and it is properly packed and sealed. After doing that, we will now proceed to the performance of the procedure. But remember that prior to the performance of the procedure, first introduce yourself to the patient and then verify the patient's identity and discuss or explain to the client what you will be doing, why is it necessary, and how the client can cooperate with you during the procedure. And then perform hand hygiene. And provide for the client's privacy. If the client is inside the ward, close the curtains around the bed, or if the client is in a private room, close the door of the room. Now, we will proceed to the application of the sterile gown. First, open the sterile glove packaging. And then, remove the outer wrapper of the sterile gloves or from the sterile gloves, and then leave the sterile gloves into its inner sterile packaging or wrapper onto the sterile field. And then after doing that, we will now also unwrap our sterile gown. And then we will perform hand hygiene again. And after that, we will now put on our sterile gown. First, grasp the sterile gown at the piece near the neck, and then hold it away from you or your body, and permit it to unfold freely without touching anything, including the uniform. after that, put your hands into the shoulder of the gown and work your arms partway into the sleeves without touching the outside of the sterile gown. Keep the sleeves of the gown at above your waist level, and then work your hands down to the sleeves only at the proximal edge of the cuff. And then, have a co-worker grasp the neckties and tie it without touching the outside of the gown. After that, pull the gown upward so that the neckline of your uniform is completely covered in front and in back. So, let me just ask my co-worker to tie the neckties of my gown. Thank you. Now that your gown is halfway fixed, we will now proceed to the donning of the sterile gloves closed method. First, open the inner sterile package of the glove which has the sterile gloves on it. And then, after doing that, place the first glove on your non-dominant hand, which is my left hand. With your dominant hand, or using your dominant hand, pick up the opposite glove with your thumb and your forefinger or your index finger, handling it through the sleeves. And then, lay the gloves over the opposite gown cuff, thumb side down, and the glove opening, or with the glove opening pointed towards your fingers. Position your dominant hand palm upward inside the sleeves, and then using your non-dominant hand, grasp the cuff or the glove's cuff through the cuff of the gown and firmly anchor it. And then, with your dominant hand working, grasp the upper side of the cuff of the glove laying on your sleeve, and then stretch it over the cuff of the gown. Adjust the gloves, and then pull the sleeve up to draw the cuff over the wrist as you extend your fingers or the non-dominant hand fingers to the glove's fingers. Now, after put putting the first glove on the non-dominant hand, we will now place the remaining gloves on our dominant hand. So place the fingers of your sterile gloved hand under the cuff of the remaining glove and place it over over the second sleeve of your gown. Extend your fingers into the glove as you pull up over these gloves, over the gown, or over the cuff of the gown of your dominant hand. Now that we're done in the donning of the sterile gloves closed method, we will now proceed to the completion of gowning. First, have your coworker grasp the two ties of your waist ties using a sterile gloves, sterile forceps, or drapes. So let me just call my coworker. So have your coworker hold each side of the ties and tie it at the back of the gown. So make sure that your gown or the uniform is completely covered. Thank you. Now, when worn, the sterile gown must be considered sterile in front from the waist to the shoulders and from the sleeves from 2 inches above the elbow to the cuff, because a scrubbed person will move its arm across the sterile field. And then, when you're done with the procedure, remove the sterile gloves and the sterile gown and discard it to the appropriate container. There is no special technique in removing sterile attire, but if they are soiled in secretion, remove them by turning them inside and out and then perform hand hygiene. So first, I will remove my sterile gloves. Then turn them inside and out. perform hand hygiene. If necessary, document that a sterile technique was used in the performance of the said procedure. Now for the evaluation, conduct any follow-up indication during the care of your patient and make sure that there is an adequate number and type of sterile supplies available for the next healthcare provider. That's all. Thank you.